So, thank you again for the invitation. That's a pretty big challenge for me to talk about pragmatism, because before COVID-19, I didn't even know what pragmatism was in clinical trials. I've been doing clinical trials all my life, and especially in HIV, hepatitis, and I've been doing, just regular clinical trials. And when I first heard about pragmatism, I was really wondering, what is pragmatism? Pragmatism, we are all pragmatic, but in fact, we are not. We were not. And that's why I think that kind of workshop is really interesting for people like me, who are not that knowledgeable. So I will not talk about pragmatism right in clinical trials, because I wanted to have a bigger focus, and especially because I wanted to introduce you with our proactive response program, which has a part of clinical trials, but has also a larger focus. So I've proposed to talk about pragmatism in pandemic preparedness, which is a big wider than just trials. So here are my conflict of interest, nothing linked to this presentation except that we got money from EU for our funded consortium. And to introduce that talk, I wanted to go back to some definitions about pragmatism in pandemics. And you have all seen, because we have all experienced that during the pandemic, that it has posed us a unique challenge to governments, organizations, and societies, because it really combined medical, societal, economic, and political uncertainties. And what's being pragmatic? Well, it's adopting a flexible, experiment-driven problem solving, and that really makes the difference between success and failure during such crisis. And we have all seen that pragmatism involved using experimental, trial and error strategy based on fast feedback loops. And in fact, instead of following a rigid one principle structure or plan, pragmatic preparedness that recognizes uncertainty and adapts as new strategies emerge. So it's all about balancing caution, proportionality, and flexibility. So in this table here, I've compared the principled approach and the pragmatic approach. I've tried to summarize a little bit what's principled and pragmatic approach. So as a central theme, this is a one core value that guides all policies: principled approach. Pragmatic approach: sequential experimentation and feedback-driven adjustment. About communication, when you are following a principled approach, you have clear, consistent messages, sometimes a bit rigid, that you can't really change. And during the pandemic, we have seen that, when government had a principled approach, it was very difficult to gather all the citizens around that. Pragmatic approach, more flexible, but of course, it may appear less predictable. Regarding the policy change, very infrequent, only with compelling evidence. And I will give you some examples with countries using another pragmatic approach during the pandemic. France, for example, we followed only a principled approach. Pragmatic approach in policy change, very frequent, small-scale adaptations. And of course, all those both approaches have advantages and disadvantages. Principled approach, advantages, it's strong, there is a clear leadership vision. Pragmatic approach, it's more flexible, but there is less risk of large failures. Disadvantages, high risk of inflexibility, sunk costs. Pragmatic approach, harder to communicate changes. It may look a bit indecisive. So if I go right to the core principle of how to be pragmatic, I've listed 9 core principles, and I will review them with you. First of all, precaution. When we want to be pragmatic, we need to use precaution that account for the potential severity of threats. It avoids underestimating the risk involved, and early action. Precaution is better than waiting for certainty, given the unknowns in a novel pandemic. Proportionality, second very important core principle. Scale of response should align with current risk assessments, and balanced intervention for both high and low impact scenario should be imagined without overreacting or underreacting. And I'm sure that you have the pandemic in your head, behind your head, and you can see that all those principles really applied to many countries. Some of them, being pragmatic or not. And as I told you, I will show you a comparison between 5 countries, and you may guess which ones were pragmatic or not. Third core principle, flexibility. Flexibility, it's very important, and we've seen that. Now, if you go back to trials, some trials were very flexible, some other were not flexible, and the most flexible trials had a response to drug efficacy in a very quick manner, where other trials, ended at the end of the pandemic. So response framework must be agile, allowing for adaptation when there is an evolvement of the situation or when new evidence become available, for example, various characteristics, emerging treatments, or varying regional impacts. The fourth core principle is engagement. Engagement is really at the core of a pragmatic approach, and especially involvement of multidisciplinary team, which include public health, social, economic, political actors, and this is really essential for effective preparedness and response. Fifth, continuous monitoring, the system for real-time data collection, feedback, scenario-based exercises that will ensure ongoing adaptation and improvement, and we've been talking about that this morning. Continuous monitoring, absolutely paramount. Transparent communication, and I think that this is something that we have not been very good about at the beginning of the pandemic. Transparent communication, clear, honest communication about the uncertainties, changing of policies, and the reasoning behind those changing is absolutely vital in building and maintaining public trust. And then the last 3 core principles: integrated logistics, of course, robust planning for medical equipment, vaccine distribution, workforce, supply chains that will ensure essential services, and we have to make them operational under strain. The other pragmatic core principle, it's an interdisciplinary approach, and we are here to witness how important it is to integrate all health measures with social, economic, legal framework, so we can address the broader consequences of pandemic response and safeguard vulnerable groups. And finally, regular exercises and red teaming, which means frequent preparedness drills, external assessments, critical reviews that might strengthen the ability to respond effectively to novel threats. So you see, all those 9 core principles, it's like a plan for tackling future pandemics in a pragmatic way. So to give you an example from more on the policy side, how countries were pragmatic in tackling COVID-19 pandemic. In this paper that I've given you the reference below, the authors have compared 5 countries, sorry, not Ireland, but UK, France, Germany, US, and South Korea. So given all those core principles I've given you about pragmatism, you'll see that some of them were very pragmatic. Some others, like France, were not pragmatic at all. So the initial approach in France during the pandemic was relatively loose mitigation strategies. And all of a sudden, in March 2020, we escalated to strict lockdowns, emergency measures, when case surge in the country, where we were very close to Italy, and where they've got all those cases late January, February. We were just looking, and waiting. Oh, is it gonna cross the Alps? Oh, in Italy they were not very good doctors. That's why everybody was dying. That we could hear that in on TV, radio, etc. So the measures: national lockdown, closure of borders, mandatory mask in public, use of military and medical trains to redistribute patients, and mobilization of healthcare workers. So everybody was so happy. We could have those big trains to transport the patient at the other part of the country. We are very proud of that. Well, no anticipation, in fact. And the surveillance, French authorities had a centralized contact tracing through designated hospitals and hotlines, but it came in very late. What about the United Kingdom? So the initial approach, it initially leaned toward a mitigation, herd immunity. So you've heard about that by the Prime Minister of that period, with a slow escalation to a full lockdown after surge in cases and high death rate. So the measures about the same that in France, national lockdown testing and tracing program, phased reopening and targeted communication campaigns. And the surveillance, there was an NHS-led national tracing and self-isolation policy. The states, initial approach, patchwork response between states, federal guidance, but it was a delayed but aggressive national action, measures, state-level lockdown, inconsistent mask mandates, a lot of battles between those, mask, no mask, etc. Temporary hospitals, support for vaccine and rapid test development. The outcomes were a high number of cases and death disparities between states based on policy strictness and timing. South Korea, initial approach, immediate, aggressive containment, large-scale testing, isolation, digital contact tracing from early outbreak stages. They had knowledge of previous outbreaks, and especially SARS-CoV, the SRAS epidemic back in the 2000s. So measures, extensive testing, rapid case isolation, use of technology for contact tracing, maybe some issues around ethics and data protection. And there was a limited but targeted mobility restrictions. And finally, they maintained a low case and mortality rates without nationwide lockdown. So if we look at this table here, look at the impact, because everything inside I've told you about in the previous slides. Impact of France, high mortality, health system strain. Germany, lower mortality, system resilience. UK, high mortality, a kind of late adjustment. US, high mortality, uneven outcomes. And finally, South Korea, very pragmatic approach, low mortality, control spread. So in fact, the country with the faster, more flexible responses, answering to the core principle I've listed you earlier, they were able to mobilize resources, scale testing quickly, adapt policies. They did a lot better than those with initial slow or rigid approaches. And if I go back to France, because this is the example I know the best, its reliance on national measures did ensure a strong public compliance when they were implemented, but in fact, the delayed, very centralized decision-making compared to Germany's, for example, decentralized flexibility or Korea's aggressive tracing. Well, in France, it limited its early response effectiveness. So but we are not a pragmatic people, never. So I hope that with the work we are doing now, we might change the global spirit. And to go back to PRACT EU response that I will talk to you about now, the idea of PRACT EU response emerges from the need for a pragmatic approach in research for pandemic preparedness. Until now, I've talked to you about pandemic preparedness in a global manner. I've given you examples not on clinical trials, but more on policies. But we know that during a pandemic, this is research which feeds the decisions of policies. So, in fact, uncertainty is inevitable. New pathogen will bring unpredictable effects. Pre-designed responses may prove inadequate or excessive. The speed and flexibility save lives. You've seen from the example I've given you, South Korea, very quick, very flexible. So definitely quick adjustment enable responses to real-time data, reducing both health and economic harm. The public trust requires agility. The populations notice when leaders respond to evidence instead of sticking to dogmas. And we've got many examples of those leaders, sticking that are stuck to dogmas, US, for example, or leaders that have really implemented evidence into policies. Most of the European leaders have done. And it really boosts confidence in institutions. And that's what we need during a pandemic, to gather everybody and provide confidence in what we are building. And finally, limited resources demand realism. So what is proactive response? What did we have in mind when we designed this European consortium? Well, to bring an integrated response based on pragmatism in research and to feed response to the next pandemic. So we 2 years ago, we answered that call, which was a EU call with the following expected outcomes. So that call wanted to fund multi-country adaptive platform trials, but not only. Of course, having money for platform trials is very important, but on top of that, the message of the EU was to provide innovative and improved design for pandemic preparedness, available for the whole clinical research community, in the capacity to deliver robust clinical evidence in a diverse European population using harmonized research methods, data collection, and analysis. So, in that view, we have submitted the Proactive Response project, which has been funded. We were very proud because 10 projects have been submitted, only 2 have been financed. One, which is ours for in-setting patients, and the other one is for children and mothers. So we are very complementary. The other one is pipeline. I don't know if you have heard of it. So the other objective of proactive response is to prepare Europe for future pandemics. So this is very, very ambitious by strengthening upon existing networks of experts and also civil society, focus on clinical therapeutic platform within hospital inpatient settings. And I was very happy to hear this morning that a lot of you are very much involved in including patients and citizens right from the beginning of the design of research. With 6 sub-objectives: first, to expand the network of clinical centers across Europe, then to strengthen the laboratory network across Europe, to support a network of methodologists and trialists. And this is the first time I really understood the difference between a trialist and a methodologist and biostatisticians. Then initiate a network of professionals to work on preparedness tools, build a network right from the beginning of social science researchers to understand the dynamic of inclusion of patients and on an equitable manner in trials. So to understand the nuance, to provide a nuanced understanding of the social context, and finally establish a community group to work on activities that will empower patients and citizens in Europe for their own health and educate them about science and health issues so we can tackle infodemia and fake news. So the key factors for success of a pragmatic approach are listed here, 4 of them, and oh my God. I'm too long. Okay. Proactive response, that's a network made for readiness. We have 7 work streams. I won't go into details, okay? Partners and countries across Europe, 25 partners, 11 countries. We have a network of 85 clinical sites. You have here the list of all the partners. And this is coordinated by French research organizations. Here, you see that we are covering almost all of Europe, and we are pretty happy with that. We have some gray patches, but I don't know, in some countries, they just said that, we don't want to integrate that network. Sweden, for example, and in other countries, we did not have any people there. Innovative trial methodology that can smoothly pivot from interpandemic to a pandemic mode. Don't have time, so I won't go through that. Strong governance and coordination mechanism. And this is absolutely paramount to work with other trial platforms, broader networks across the world, like Strive, and work in coordination with other modules, coordination modules at the European levels. And also seek guidance from agency, which means that we have to work hand by hand with agencies such as EMA, ECRIN, COMECT, etc., and stronger governance structures. So I don't have time to go through all that to show you that we really have an adaptive infrastructure for rapid response capacity, but this network is very flexible and will be capable of pivoting quickly for facing new health threats. And this is really, it's almost the end. This is really at the core of all the challenges we have to face with those huge consortium. The funding model. Okay, we've got money from EU for 5 years. What next? This is really at the core of the success. So we've got money from Horizon. We've got resources from government agencies, but on top of that, we need to go for other modes of funding. And this is being pragmatic, not just waiting for the governments or the EU, on top to give us money all the way down. So in conclusion, pragmatism in pandemic preparedness implies caution, proportionality, agility, flexibility, and reflexivity from all actors, including politics, researchers, and civil society. Preparedness is really key for tackling the next pandemics. I know that everybody won't say no, and that was a capacity that has been missing in many sectors of countries during the last health crisis. Europe is investing in pandemic preparedness, millions and millions of euros, and is asking for a very pragmatic approach so we won't repeat the mistakes done earlier. So is PRACT EU response tailored to bring that pragmatic approach to therapeutic research in the context of a pandemic? Well, we have 5 years to demonstrate, though. We hope to succeed, and we are working very hard for it. And Declan, for example, is one of our partners, his team, and he has published the first paper of the consortium, so thank you very much. And yes, I will take questions as well. Thank you.